So I'm spending a little bit more time at home than I usually do at the moment due to the coronavirus situation. And after spending a day around the house with my kids, it got me thinking about what should we be doing to look after our kids at this time when we've got very limited access to the normal treatments that we would choose. With our daily routines upset, it is a little bit more likely that we slip into habits that may or may not cause us problems. So we need to remember that things happen faster in children's mouths, and to get decay, you need sugar, bacteria, and time. And those things, when they come together in the right mix, will cause decay. Now, any sugar that they consume is then taken up by the bacteria, which make acid, and the acid then attacks the teeth. If you repeat that over a long period of time, then eventually you end up with decay or a cavity that we end up having to treat at the practice. So my recommendations for things that you can actively do for your kids at the moment are to minimise the frequency of sugar exposure. So that means, first of all, trying to keep them to 3 square meals and minimise snacking that goes on. When we're at home all day, it's easier to pick away at biscuits or treats, but try and avoid that. And if the kids are snacking, then try and make sure that it's on something that's sugar-free. Drinks between meals, very important. That should only be water or milk. If you must use juices, the juices have to be sugar-free. Things that say reduced sugar or no added sugar are not necessarily better. It's the same as diluting normal juice down a lot, but it doesn't make it less harmful to the teeth. It is the total frequency of sugar intake that causes problems rather than the actual amount of sugar. In terms of the bacteria side of the equation, this is just really about thorough brushing and making sure that your kids clean at least twice a day. If ever there was a time to look at how they're brushing their teeth, it's now. Even with older children, it's wise. Maybe even think about digging some of the disclosing tablets out of the bathroom cabinet and having a go with those. If we can reduce the total amount of bacteria that's present in our children's mouths, then when the sugar is consumed, there are going to be fewer bacteria to turn that sugar into acid, and therefore the damage that will be done will be less. And finally, make sure that you're using a good quality fluoride containing toothpaste that's somewhere between 1,000 and 1,500 parts per million, depending on your child's age. That number's normally stamped in the label on the back of it. So there you go, that's just a quick run through of the things I think we should be doing to look after our kids' teeth at the moment. We'll see you soon.